Hi everyone, my name is Whitney and I am a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Let's talk about cold sores. And before we jump in, let me quickly remind you about my website, teethtalkgirl.com. If you're ever looking to learn more about a specific dental topic, I have a search bar where you can easily find what you're looking for. And also my Instagram, @teethtalkgirl. Cold sores are almost always located somewhere on the outside of your lips or the corners of your mouth. If you have what looks like a really large ulcer or a cluster of blisters that are painful, it's likely cold sores. And to get rid of them, it helps to know the warning signs and steps to take when you first feel symptoms popping up. So really quick background knowledge on cold sores, also known as fever blisters, also known as the herpes simplex virus or HSV1 or herpes labialis. A cold sore is from a virus that's inside of your body and it's contagious. And they are most contagious when they are visible in their active blistering state. Cold sores often decide to flare up if you're exposed to things like stress, sunlight, or a recent illness. Anytime your immune system is suppressed, it provides an opportunity for dormant viruses like HSV to pop up and make an appearance. And having said that, if you do have an active cold sore, most of the time dental offices do not want you to come in for your routine dental appointments. They would usually prefer you to reschedule your appointment because, like we said, they are most contagious when they're active. So it's better to wait until after they're healed. So if you do have a cold sore, always call ahead and ask what your dental office wants you to do. However, if you do tend to get cold sores often, definitely talk to your dentist about it. They can prescribe you an antiviral medication to help with flare-ups. Some dentists even offer laser therapy where they can treat the area of your lip right as you feel the tingling sensation that fever blister is coming on before it actually flares up. And although there's no way to really reverse a cold sore, there are plenty of things you can do to limit how big they get and how long they last. Over-the-counter ointments like Abreva, Docosanol, antiviral meds can generally be applied as soon as you feel a cold sore forming. But if you're someone who tends to get multiple cold sores per year, it might be better to, like I said, ask your dentist or doctor for a prescription. Some of the most commonly prescribed antiviral cold sore medications include acyclovir, famciclovir, valacyclovir, and penciclovir. Depending on which medication it is, it can be a cream you rub directly on top of the cold sore site or a pill you take by mouth. Just be sure to not cross-contaminate your medication by touching the tip of the ointment container to your mouth. Otherwise, you'll spread the virus onto it. Instead, use a separate applicator like a cotton swab for single uses and then throw them away. Also, one more thing you can ask your dentist, like we mentioned, you can ask if they have a laser in their practice. If they do, call their office the second you start to feel early cold sore stages of tingling and burning. And by treating the area with a laser, your dentist can cut your cold sore time in half. Now, home remedies. Although a home remedy won't instantly heal you of a cold sore, they may offer some temporary relief. Some people swear by rubbing an ice cube on the area, rinsing with apple cider vinegar, dabbing tea tree or peppermint oil onto it, taking lysine regularly, and or applying lemon balm on the skin. If you are a DIYer, it doesn't hurt to give these a try. In all, since there's not really any way to prevent HSV from causing a cold sore once it's inside of your body, you can reduce the length of time that you have a cold sore by having the right medication on hand, whether it be over the counter or a prescription. And of course, always be sure to follow the directions and instructions carefully. If you've never had a cold sore before, shy away from sharing foods and drinks or kissing someone who is exhibiting cold sore symptoms. Taking care of yourself, minimizing stress, and applying sunscreen are all things that can help lower your chance of getting fever blister flare-ups. By the way, cold sores are not the same thing as canker sores. Canker sores are ulcers that can be found inside of your mouth that are not caused by viruses and are not contagious. If you want to learn more about the differences between cold sores and canker sores, I will link that video of mine in the bottom bar below. I hope this video helped you. Please like and subscribe if it did. Until next time, peace, love, and teeth.